With the rise in Guillain Barre Syndrome or GBS cases in not just Pune but Maharashtra, Andhra Pradesh, Assam, Rajasthan and Kerala, the condition has become a topic of increasing focus and concern in recent times. We are about to discuss everything you need to know, right from symptoms, early detection to treatment options, recovery and so much more. Joining me today to guide us through this session is Dr Ritesh Shah, MD, physician practicing in South Bombay. Doctor, thank you so much for taking the time to join us today. I want to start by asking, what exactly is GBS and how does it affect the body?
So basically it is a progressive muscle weakness where body's immune system attacks their peripheral nervous system.
Okay. So basically it is something that attacks the nervous system is what you're saying, right?
So their myelin sheath gets disturbed by the attack of the nervous system.
Okay. And what causes this? We often hear that there is a connection to infections. How did that come about?
So you rightly heard. So a lot of cases we have seen, and that is because predisposed because of infection. There is a case patient have sore throat or they have a diarrhea. So usually they have 3 to 4 weeks prior history of having severe sore throat or diarrhea. So there are various viruses which are linked to this kind of disease.
What are some early signs and symptoms that one can, start to see on the onset of this syndrome?
Most likely what we see is a weakness. They will have a lower limb weakness which is gradually progressive.
Right.
So patients have weakness, they will have difficulty in walking, they will feel oral fatigue, tired. And sometimes patients can have autonomic dysfunction also. I had an interesting case recently where patient had a very high blood pressure. So BP was quite high, 180 by 100. And then we found that autonomic dysfunction, that the shoot up in the blood pressure was because of this patient having GBS.
Okay. So have you come across someone who has the syndrome?
So yes, recently I had 2 patients last month who had GBS.
Okay.
So one of the patients which I told had come to my clinic, he had imbalance while walking and he had very high blood pressure. So first thing we thought of stroke because he had a very high blood pressure, whether maybe brain hemorrhage. But when we got him to the hospital, we investigated him and we found that he had a GBS with autonomic dysfunction.
Okay. So just getting back to that, is this syndrome something that can affect people of all age groups, or are there certain age groups that are more prone to this?
So practically we have seen this disease affecting all the age groups, but yes, younger patients we see good recovery, elderly age above 40 years, then usually we see there are more chances of complications, or patients who have other comorbidities, then there are more chances of infections and complications.
Okay. Now, if someone suspects that they have GBS, what are the first steps that you would suggest that they do? The first steps.
So first message what I want to give everyone, don't get scared. This is very rare disease, not we see very commonly in our practice. So yes, but if you have fatigue, you have muscle weakness, particularly in the lower limbs, which is progressive. Gradually you think the weakness is increasing day by day. Definitely go and see the doctor, ask them to examine. But I get a lot of patients, they are scared. So a lot of other reasons also for lower limb weakness, not just GBS. So don't get scared about this disease.
GBS, since it has a wide range of symptoms, is this something that can be misdiagnosed with something else?
Yes, you rightly said. So there are a lot of patients we see with a low potassium. Some patients will get them low potassium. They can have hypothalamic periodic paralysis, we say.
Right.
Because of the drop in potassium, they get weakness and lower limb weakness and gradually progressive weakness. Or sometimes patients have some myelopathy or some nerve compression. That time also they can have lower limb weakness. So they have a lot of differential for these conditions.
What are the most common ones that you have seen?
So commonly what I have seen is a low potassium. Patient having low potassium and weakness, which and after correction potassium, patient was absolutely able to walk freely.
So what are the diagnostic tests that we use to confirm GBS?
So most important is clinical diagnosis. So whenever you have such patient, always have a strong clinical suspicion. Clinical sign, what we say, the reflexes are absent. When we do neurological examination in our patient, we say their lower limb reflexes are completely absent. So reflexes are absent, which favors in the presence of GBS. Also, they will not have any bladder complaints like urine problem or stool problem. That is also then again favoring diagnosis of GBS. Confirmation test, we hospitalize them, we do nerve conduction study and we do CSF study, which is a spinal fluid study. These 2 tests helps to confirm the diagnosis of GBS.
What are the main treatment options that we have in India for GBS?
So there are various GBS variant also we see. One is acute inflammatory demyelinating neuropathy. One is chronic diseases. Or there are various variant of GBS like Miller-Fisher variant, which is one of the variant of GBS. So when patient of GBS is confirmed to diagnosis is confirmed, we have two options. One is IV immunoglobulin and plasmapheresis.
This is caused by the bacterium Campylobacter jejuni.
Yes.
Now, is this the only bacterium that causes it?
Yes. So there are a lot of bacteria, viruses. So Campylobacter jejuni is common. So that's why I mean everyone has heard about it. So 30 to 40% cases are because of Campylobacter jejuni. But we see it's because of cytomegalovirus. A lot of time patients after vaccination also we see patients developing GBS. In fact, after COVID vaccination, we have seen good number of cases who had GBS.
Now, you just mentioned COVID. Is there a thing where if you've had COVID before, you are more prone to get GBS? Is there any logic behind that?
So there are no studies as such which supports, but yes, we have seen a lot of patients, particularly COVID after vaccinations, we used to get a lot of GBS patients. So yeah, there are studies and there are patients who have been diagnosed with GBS after COVID vaccination.
Okay. And what does the recovery process look like?
The recovery is very good, but depends upon the time the patient presents to you in the hospital and rate of recovery or the extent of recovery will be different. So patient present to you in the right stage, and when we start with IV immunoglobulin or plasmapheresis, the recovery is very good. Most of the patients, they do recover, but long term they require good physiotherapy, rehabilitation that is required.
What are some ways that you would suggest how people can prevent GBS?
So good hygiene, most important. So because we are seeing that patients get this viral infection or bacterial infection and then they get GBS. So good hygiene, good exercise, regular workouts, and not to get scared about this disease. It's very rare, it's not so common, but yes, we need to be cautious.
Are there any vaccinations for this yet?
No, so there are no vaccination for GBS. It is in disease which has to be prevented by good hygiene and taking good care of your health.
Is it in works or there's no vaccine?
There's no vaccination
at all?
because your body own immune system is attacking your peripheral nervous system. So there are no vaccines for this.
We recently saw the FDA's findings where they ruled out chicken contamination, raw chicken contamination. Can you tell me what brought the possible link between raw chicken contamination and this in the first place?
So because we have seen cases in the past where I had diarrhea and other symptoms before developing GBS. So yes, maybe there's bacterial infections or viral infections. So that's why the FDA had to rule out this.
Okay, so that's not really a source, is
no, that's
what
not
you're
the
saying?
source, no.
Okay. But why did people think that that was the source then for quite a bit of time?
They had this gastroenteritis and diarrhea and more after eating food. So symptoms, and then they developed this GBS. So that's why they got a little scared about that.
What are some common myths that you have heard about GBS that you would like to debunk today?
So I heard in the hospital, like they were saying this is contagious or you can spread from one to another.
So it's not?
So it's not contagious. Okay. GBS can't, you can treat the patients very well, it don't spread. So that is a myth which we should, and it is easily treatable disease. It's not like we can't treat this disease. So if you present the right time to the doctor and you get investigated, thoroughly diagnosed, you can easily treat. This is a treatable condition, nothing to worry about it.
Before we wrap up, if you were to talk about a few tips to stay safe while this is going on, what would be a few tips that you would suggest people in a way they could take care of themselves and others too?
Yes. So I really like to tell everyone not to get scared. This is not a very common disease because I see a lot of patients coming to my clinic and asking me about GBS, and they have weakness and they get scared about GBS. It is not a severe disease and it can be easily treated. So if you have symptoms, progressive weakness of the lower limb, and then you definitely go see the doctor, get it examined, and we can easily treat this. So not to worry.
Okay. With that, we conclude today's session on GBS. Thank you so much, doctor, for taking the time to join us, and hopefully now you have a clearer understanding on Guillain Barre Syndrome. Thanks for tuning in. I am Diya Ipin, and I'll see you next time right here on CNBC TV 18.
Hey, thank you for watching this on CNBC TV 18. Hope you liked it. For more such interesting news and updates, follow CNBC TV 18 on all the social media platforms.